All right. Well, this is Chris Straff. I'm excited to be here as a moderator for Project Radical as we go through November and have these discussions as it relates to understanding how Black people specifically are affected by lung cancer. And to be able to understand that, it means we have to have multiple perspectives. And today's discussion is really talking about that initial diagnosis, the initial diagnosis of lung cancer, how that it happens as it relates to a survivor. What does it mean for a caregiver? What does that mean for our primary care docs in terms of understanding lung cancer? Where do they see it? Now, again, the idea is to be able to look at it more from Black people and understand that perspective. But so many of the themes will go across. We'll go across the different races, and really, there, unfortunately, in lung cancer, there's too many similar stories. And so, just before we make sure that people understand, for me, it's personal. Chris, my wife Keisha was diagnosed with lung cancer at 37 years old in 2010, and unfortunately passed a year later in 2011, December of 2011. Amazing shape, never smoked, just this amazing pillar of health, and a little shortness of breath, and went to her primary care doc. And the primary care doc did a chest x-ray and found out that she had lung cancer. And so that awareness that anyone can get, it only happened based on being right there with my wife or my future wife. And so as we talk about this, I think that the key is to recognize, and I want to ask this first question. Noemi, you are a survivor, and I want to ask this question. Did you know that anyone could get lung cancer? When were you diagnosed? And how did it feel?
Hi, everyone. My name is Noemi McDonald. I was diagnosed in 2015. I never heard of lung cancer before. I seem to be okay in health, but I ended up at the ER. I was feeling what I thought was a very, very bad heartburn. I went to the ER and they started doing tests, and I ended up hospitalized for a week. And that's how I found out that I had lung cancer.
So Matthew is a primary care doc, and I want to weave some folks in as we're having this dialogue. And so Matthew, as a primary care doc, can you talk about how lung cancer, too often when it's diagnosed, that there's not a lot of symptoms before it ends up stage 4?
Yeah, that's right, Chris. And in some ways, that's the problem. If lung cancer was really obvious, then we'd diagnose people earlier and people wouldn't present at late stages. But you're right, many of these early symptoms are really quite subtle or mild. Some people mention losing a bit of weight, or just feeling less active, or not feeling as easy to walk to church or do what they used to. These very subtle symptoms. And I think many patients might misinterpret those as, I've got some heartburn, like you mentioned, or I've got a bit of a cold or a bit of a cough. Of course, that's natural. And when you go to see your primary care doctor, they often do the same, thinking, well, acid reflux is common, probably acid, or maybe you've got a cough from asthma or something, that's pretty common. So these early stages, it's very, very difficult to distinguish early lung cancer from all these other common conditions. And that is the problem. That is the problem.
Awesome. Well, and again, it presents a problem for our primary care docs, but at the same time, it presents a problem for individuals to be able to understand what's going on. And so heartburn, does that tell you we need to run into the hospital and get checked out? Or does it just seem like something that is subtle? So Maisha Staniford is on the call as a caregiver. Very often it's the person that's right by you that really helps you know that there's something that's wrong. So can you talk about that process of being a caregiver and did you know that there was potentially something wrong before that diagnosis?
Yeah, I can speak to that in terms of um, some things, looking back onto when my husband was diagnosed in March of 2020, and kind of right before his 48th birthday. It was 10 days before his 48th birthday. And he had a nagging cough about 3 months. And so, but then we went back a little further, and we recall over that past year, we went to the hospital 3 times. One time we went when his shoulder was really hurt and was giving out. And I'm thinking, okay, what's going on? Of course, me being in the healthcare, in public health field, I'm in cancer disparities researcher. You're thinking, hey, I should know. But again, I was still not aware of all the symptoms, right? And so even working at a prominent healthcare center and still not aware of lung cancer disparities and those particular symptoms. So again, looking at from the outside as a caretaker and the spouse and the best friend of someone who was suffering from stage 4 cancer, had no idea. Again, not able to walk or not able to breathe as frequently, and some back pain. And he continued to ask every night, "Can you rub my back?" And I'm thinking, okay, as a wife, one side of me is like, oh my goodness, I have to rub your back every night. However, again, going back and thinking, that was a symptom. Again, we were very, attuned to practices in terms of alleviating pain and treating, but not getting to the root. So we went to the chiropractor, went to acupuncturist, and the chiropractor said, "Oh, I can realign you. I can do these things." And we're like, "Hey, all right, we're getting there. We're getting somewhere." But again, when the pain still persisted, actually got worse, then we said, okay, it's time. So over that previous year, there were signs as we look back to it. So sometimes there is a little bit more, as Dr. Thompson mentioned, that you can kind of take heed and say, hey, let me go get tested. I will add an additional component is that my husband was not an advocate of going to the doctor, I would say. So that's another component that I think, of thinking about the hesitancy, or whether it was, hey, let's go on. So of course, I'm the one making the appointments, right? So we have to make sure that, the spouses and the wives, I'm the one making the appointments. I'm the one doing all those things. So it's very key to kind of be in tune with the body and also continue to stay abreast of symptoms. So.
Awesome. Thank you, Maisha. And I asked that question for that reason. I mean, you got right to it, that in part that says that, based on, how you're feeling, if you have a relationship with your doctor, it's going to make it where you'll be hesitant to go in. But then at the same time, if you don't have these tremendous symptoms, is it really telling you to go in? Right. And so, that's the difficulty with lung cancer. And I know Mouraf, he's here on this call. And he's our leader for Project Radical. I gotta weave him in, because as a primary care doc, so he's kind of this mix of all of this. Is a primary care doc that's also a lung cancer survivor. And so, Mouraf, when you're diagnosed as a primary care doc, are you even thinking that this could be lung cancer based on your symptoms?
Yeah, no, I was 33 when I was diagnosed. So no, lung cancer was not the first thing that came to my mind when I became short of breath. I was working out and trying to build stamina. Now thinking back, I would say maybe I was feeling weaker and weaker because of the illness and its progression. I started working out when in the middle of my exercise routine, I became very short of breath. I knew that something was wrong, but that had already crossed the threshold. I had over 4 or 5 liters of fluid in my left side of the chest. So, and I had access to doctors. I had primary care doctor that actually I've seen probably 3 or 4 months prior, also for some vague symptoms. But at that time, it did not cross our threshold to say, hey, well, maybe maybe it is something that we need to investigate, because as an average healthy otherwise person, those symptoms would not make the person the primary care doctor. And the same thing for me, if I were on the other end, would not make me think, as Matthew said, this is lung cancer, let's get the x-ray, let's get the CAT scan. But then what's going to make the difference is, as the symptoms would continue, or as they would become severe enough, then that's where the pathway would launch, or people would start going on that pathway to diagnosis, getting the CT scan or getting the X-ray, that then would be followed by the CT scan, sometimes presenting to the emergency room when things are not good. So the key message here for me and for everyone else, that anyone can get lung cancer, regardless of age. Of course, with age is a risk factor, smoking is a risk factor. Other exposure to radon, for example, is a risk factor. But even without those, the person could develop lung cancer. So being vigilant about those, especially in the earlier stages, does not mean everybody with shortness of breath need to get an X-ray. Does not mean everybody, of course, unless they have other symptoms. Does not mean everybody with a cough for a week or two need to go into that path of diagnosis. And that's where the fine tuning. But having a plan for that person. Hey, your cough has been going on for 2 weeks. I'm not as concerned as of yet. Maybe 1 week, maybe it's going to get better in 2 or 3 weeks. But then if it's not getting better with 6 and 8 weeks, I want you to come back. If you start losing weight, I want you to come back. And a person who's having those symptoms, get that complete history. This, again, the message for the PCPs, get a full history and have a plan for follow-up. This is not someone that you would send and then it would fall into the crack. People with cough, with a little bit of trickle in the throat, well, I say could more likely to be GERD than lung cancer, true. But then if with treatment after treatment, you're not finding an etiology, maybe it's time to question your diagnosis and explore other things. And I will jump off the panel. Thank you for inviting me.
No, so yeah, thank you for sharing. Because again, you are, when we're talking about lung cancer, we absolutely have to talk about Black people, because that's what Project Radical is. We're focusing on that area, but we have to really set, the issues that are facing Black people, is to understand just the issues of lung cancer, right? And that says that it can be difficult to diagnose regardless of what color you are, right? You said that you have to, number one, be willing to acknowledge that there's something wrong. Maisha talked about, but it potentially doesn't even seem like that there's something really wrong. And then you might potentially have to come back, and that's the primary care doc has to work with you on being able to understand, is it something greater or is it just shortness of breath? And so I say that because, again, those are a part of what makes this difficult, right? And so, Noemi, this next question so you had to go and you thought it was heartburn. When did you find out that it was lung cancer? Tell you that it was lung cancer.
Well, I think it actually started before I went to the ER. I had an eye exam scheduled, went to the doctor, and they saw some lesions in the back of my eye. And so they were very concerned already. They told me, go seek your primary physician. At the time, she was not available. And, and then I started reflecting. I was feeling this heartburn. I started losing weight that, I kind of welcomed, but I didn't really intend to lose that much weight. So then I took myself to the ER. I thought it was unusual. And when I got in, so I ended up not actually seeing a primary physician at all at first. And I did not expect things to happen that way. So in the ER, then everything was done. I had CT, actually not a CT scan, a PET scan, an MRI, things like that.
So you said from your ER visit, what made them do a scan based on heartburn?
That's a good question. I don't really know. I just told them I'm feeling pain over here, and I was admitted, and suddenly I imagine the first thing they must have done was an X-ray. It's kind of a fog to me right now, but They must have done an X-ray, and I was stage 4, so I had bone lesions, which were probably evident on the X-ray. I had, growth in my lungs. I had growth on my bones. I had other parts of my body. So I guess it looked pretty bad. I wasn't aware of that. I didn't feel sick.
So did you have somebody with you? Did you have somebody that was, as you went to the emergency room, so you definitely just had to go, but was there somebody with you getting this information? Did you
Eventually, yeah. When they admitted me, my husband came. Initially, no one was telling me what was happening. Initially, I thought, or a nurse must have told me that I may have some kind of infection. So they wouldn't even allow my son, who was at the time, I think 4 or 5 years old, they wouldn't allow my son to see me, and everybody was, covered in protective gear. They would come to see me. They would barely let my husband come see me. It was very scary. For a week, I did not know what was happening. And only at the very last day, I remember a doctor came to see me, and he just looked at me very helplessly, and he said, "It looks really bad." And at that moment, I just got really scared. I had no idea what he meant by that. And they released me from the hospital. They sent me to an oncologist, which maybe I had a sense of what that meant, but not really understood what it meant. I went to see the oncologist, and that's when he told me I had lung cancer, stage 4. And he went about explaining there are many phases, and you're in the very last phase possible. And that was a time then that I pretty much got horrified. I did not know how to react. And for that appointment, my sister was with me. She came from Michigan. So it was very difficult for the whole family. As the days progressed, and all kinds of relatives came to see me to give me support.
Thank you, Noemi, for sharing that. Again, that point where you find out that it's cancer is the person who delivers that news is so important. I mean, get you to oncology without access, that they basically knew it's cancer, but you had to confirm it when you got there. And again, the person that delivers that news is and that's difficult to be able to get that done. So Matthew, can you speak to that? The primary care doc, where have you had to deliver the news, potentially before a biopsy where you believe it's possibly cancer, or even after the biopsy, knowing that it is?
It's gosh, you've probably seen me kind of throwing my hands up on the screen when Maisha and Naomi have been talking, because some of the work Mohaf and I've been doing is been looking how far back do people experience these changes in symptoms. Is it a month? Is it 3 months, 6 months? And if you look at some of the work we're doing, and this is in the literature, maybe up to 2 years before diagnosis. There's things changing in people's bodies. Definitely it'd be up by a year. So, and Chris, I'm going to use a footballing analogy. And if I'm wrong, if I get this wrong, feel free to jump through the screen and tackle me or something.
It's okay. It's okay.
So you were a defensive linebacker.
Yes,
that's right. So to me, it's like this: a cancer in our body is always on the offense. It's always on the offense, whether it's from an infection or a toxin or smoking or just your biology. Cancer is always attacking us, and our bodies are on the defense, but we often miss these very subtle signals. And I bet when you were a defensive player, you were pretty good at spotting those little signals from the other side. Maybe, I don't know, a little hand movement or a flick of the eye or just an expression. Is that right? You'd like,
Absolutely.
that guy's going to do something, or they're going to do this. Probably super subtle things that the rest of us would never see. And to me, that's kind of what we need to get to, rather than just taking these body blows. Like, can we pick up these subtle signals? And they're not hand signals, they're not eye movements, they're things like changing weight or like, Maisha, you mentioned like shoulder pain that was going on a bit weird.
Mm-hmm.
Can we pick those up? Otherwise, we're always going to be losing yards until it's stage 4 cancer. So sorry, that was a sidetrack, but if I got the NFL analogy completely wrong, you feel free to.
No,
tackle me.
it was great, in terms of you saying that. But that's what I'm saying is that even though you're looking to adjust, there's a point where you have to accept what it is. And so I'm asking, it's that time when you have to say to somebody. So if you were the person that had to go to Noemi, right, and say you have cancer, or I'm going to have to set up an appointment for you to go to see an oncologist, how does that go?
And absolutely, and I've done that many times. And I think what people want is a human. They want their doctor to be a human, to understand, to maybe hold their hand or even cry a little bit, because we're humans. If doctors are not humans and they lose that, you might as well talk to a robot. But I think number one is the human touch. Then number two is one step at a time. Sometimes you don't know if it's stage 1, 2, 3, 4, but saying, let's get more information. Let's take it one step at a time. And then number 3, getting the care people need as soon as possible. So not if there's delays, waits, that, trying to do whatever you can do just to cut through that nonsense and get people the care they need, whether it's the scan or the PET scan, the oncologist. And maybe that's kind of gets to some of the heart of Project Radical, because getting those parts is more difficult for African-American individuals. And that's maybe at the heart of Project Radical. It's easy if you've got insurance and great insurance and your doctor's there, but if you don't, much more difficult.
Yeah.
Yeah.
If I can share my experience.
No,
too,
absolutely.
Chris.
I want you to. I just want to say, because I wanted Matthew to have to talk about that a little bit, because again, the person that gives that information, and Maisha, I wanted you to be able to share, because it is the person giving it and then the person standing right by the person they're receiving it. So how to talk about your experience.
Yeah, the journey, in terms of the journey to cancer treatment, because as I talk about, going back and reflecting the pain in the shoulder for my husband, the back pain that he had, again, the progression of the disease, but also I share about, I was going to the chiropractor. We often went to get alignments, to get realigned, but then not thinking, because my husband had 2 herniated discs from playing sports and football, that, that's kind of okay, he's not going to get back surgery, so we're just going to go and get realignment, not thinking that is the progression of the disease by that time, right? So we continue on. And so I stated that when we went to the ER, I think Noemi mentioned, we were told to go to the ER because my husband was in so much pain and from coughing that when NyQuil did not work and he continued to vomit up NyQuil, then I said, let's go. We went to urgent care. And at that time, urgent care said, I'll give you something for your pain, but let's take an x-ray. Let's see. Again, that's another way, Dr. Thompson, in terms of talking about that treatment process. And urgent care, I don't know why she said, let's take an x-ray, because if we hadn't, it would have continued to progress. And when she took the x-ray, and this is in the midst of COVID. So I'm also explaining that this is someone who was diagnosed during the period when COVID was just starting. Yeah. So again, people were still kind of hesitant. Okay, let me go in, let's find out what's happening. So the PA said, she took the x-ray and she said, oh, okay, we need you to go to the ER immediately, right after you leave here, because we think we see something. She didn't say exactly what. She said, we think we see something. And so we said, okay, we'll go to the ER. So at that time, take my husband to the ER. We're thinking, oh, we're just going to be here 2 or 3 hours again. You know, this is the third time taking him. We'll be here. At that time, beginning of COVID, they said we are not able to accept anyone under 18. At that time, our child was with us who was 6. So I was the only one. So I had to go back and take my child back home. My husband had to go in by himself. He stayed in the hospital, unbeknownst to him, that he would stay in there for a week and a half. And that's when he was told that he had stage 4 lung cancer in the midst of COVID, the start of it. He was in there by himself. So when he called me the next day, he said, I was told I initially had pneumonia because I had, you know, he had fluid on his lung, in his lungs. So we said, okay. And he initially was told that. They went and looked a little further and said, no, you have nodules, you have an advanced cancer. And so from then on, and I tell very quickly, and I've shared this with some individuals, and in that moment when they said, hey, come see us in about 4 or 5 days, we'll get some, you know, treatment options available after he was released. I since contacted a friend of mine, and I say, thank God for those connections at Moffitt Cancer Center, which was very important for me to know who I had formerly worked with. And he connected me with a top rated doctor who was of color.
Yeah.
And so when you talk about a personal touch, when we met with her, you know, and I said, no, let's not do chemotherapy. That was the initial hospital's treatment option. And I said, and I was told, hey, we have genetic treatment for you that could possibly work. And when that person of color, the oncologist said, hey, I'm going to do the best that I know how to do. Well, you're in good hands. When that was said to my husband, it seemed like there was a relief of some sort, because there was a type of handoff, a personal touch, and it was also a person of color, which I think Dr. Manley talks about in terms of workforce development. Because for someone who was very hesitant to go to the doctor, such as my husband was, he didn't trust anyone in the doctor telling them. But when someone of color said, hey, you're in the best hands, I'm going to do the best that I know how to do and within my capabilities. That was a sense of relief. And I saw that his eyes kind of opened up out of that, you know, out of that uncertainty, as Noemi mentioned, that horrific, you know, diagnosis that he was given. And as, you know, him being my spouse, I could see that was a relief. So in terms of that journey in treatment, and as the best as he knew how to handle it, that was that. And so I just think that we needed to share that. I need to share that.
Thank you, Mais, for sharing them. And again, you're talking about, you know, Dr. Manley's work is on workforce and the importance of seeing folks. And
yes,
Miss Sydney, you know, that just joined us, who's a doctor and also a lung cancer survivor, hospitalist. And so, Sydney, you're a doctor who, as a Black woman, now you're going to be somebody that can build trust, but also as a lung cancer survivor, you know the kind of ins and outs of how difficult those diagnoses are and how important trust is too. So can you talk a little bit about your diagnosis and how being a part of the medical field potentially helped you in working through that diagnosis to get where you are?
Okay. So formal introduction. Hi, I'm Sydney. I was diagnosed with stage 4 lung cancer in February of 2017. So that's almost 4 going on 5 years now. I, at that time, was in my medical internship for my internal medicine residency. And the year prior to that, I had complaints of shortness of breath, felt very restricted on the left side of my chest. And I was working in the emergency room in Jamaica at the time. So I went to get an x-ray and found that my left lower lobe was completely consolidated. And the funny thing about it was the radiologist brought me into a room and started asking me a lot of questions, such as, are you having fevers, chills, night sweats, weight loss, lack of appetite, cough, all of those things. And in hindsight, looking back, those are things that you would think of, you know, for potential malignancy screening, and would usually trigger some sort of further investigation. But because I was young, and at the time I was on some steroids for my really flared up eczema, they said, oh, you have a walking pneumonia, let's treat you with antibiotics, and sent me on my merry way. About a few weeks later, I started having a chronic cough. At that point in time, I went to a pulmonologist, showed him the initial x-ray. He wanted a repeat x-ray. And the repeat x-ray, now this was probably 2 months after the first x-ray, still showed the consolidation. It was a little better, but not by much. And I recall even asking the radiologist, shouldn't this be clear by now? Because normally there's a lag of probably about 3 weeks. And this was now 2 months after the fact, and it was still there and very prominently there. And it's like, yeah, it's a little slow to clear, but it's clearing. And it didn't trigger anything more. And when I brought it to the pulmonologist, he pretty much said the same thing. He wanted for me to repeat another x-ray in another month. At that point in time, I was coming to the States to start my residency. So I said, I'll see a pulmonologist when I reach. Of course, internship is hectic. So it was a few months. And then I started wheezing. And at that point in time, I was like, okay, let me go to the pulmonologist. I know I had an abnormal x-ray. It should be clear by now, but I have a strong family history of asthma. Let me just go and check this out. They did tests for asthma. All of those came inconclusive. We did an x-ray over, and the x-ray image itself looked very good. I didn't see the consolidation, but the impression still said small left lower lobe consolidation. And at that point in time, I instantly freaked out. I started crying. I was on night floats at the time. My resident looked at me like I grew 3 heads. And she was like, what is your problem? The chest x-ray looks great. And I was like, but it says that I have a consolidation there that I had the year before. That means there's something in my chest. And we went to the pulmonologist the next day saying, I need a CT. There's something in my chest. I want to know if it's there. And the CT showed that there was a mass that was actually compressing my airway, and that was the reason why I was wheezing. So, you know, they say, oh, you know, don't worry, it's probably something benign. You don't have any symptoms. You're young. You're a non-smoker. And we did the biopsy. Biopsy showed cancer, and they sent me to Hopkins for them to redo the imaging. And I was then told, after a month of from CT to diagnosis, stage 4 ALK positive lung cancer. And I think for me, my advantage was, one, I knew the fact that I still had a residual abnormality in the same place 1 year later. I needed to get a CT because there was something there. A normal person would not have known that. And looking at the image itself, I would have just brushed it off. It was just the fact that I saw that impression that pushed me to go and get a CT. And I think for me, that is something that I'm always grateful for, that I was able to advocate for myself to be like, I need a CT, and that my pulmonologist listened to me. Because, you know, normally she would say, well, there's nothing wrong. We can just move forward. I think now the irony of this whole COVID situation is they've placed me on the oncology floor as the hospitalist. So I've been there for almost, I would say probably 18 months now. And I see a lot of people going through the process, and I start a lot of processes when I see abnormalities there. So I think that's one thing that I'm probably very aggressive at getting biopsies and things pushed through. Because I know how important it is to get a fast diagnosis. And I also talk to them when they're going through just the mental anguish of, oh, I have cancer. Because a lot of people, I mean, it's normal that you're thinking, okay, how much time do I have left? And as a patient, I fully understand that question. But as a doctor, I hate it because I feel that I am not God. And everybody is different. Everybody responds to treatment differently. And, you know, for me to be here 4 years after the fact with lung cancer, being able to finish my residency on time, working how many days a week, how many hours a day, and not have any issues. Yeah, no one would really expect that. So I think that's the thing. But I feel like my diagnosis has helped me to be a better doctor.
Well, appreciate that, Sydney. And again, you know, your perspective is so powerful. Again, you're talking about being able to advocate for yourself because of your knowledge, because of being in the medical field. That very easily someone doesn't challenge the system to go and those extra tests. And again, and also when we're talking about what does it mean for people who are not in positions of power and influence, you realize how important it is that you have folks around you that have those types of connections so that they can fight for you. So Alicia, you've got some history as it relates to lung cancer, but then also by being in the medical field yourself as a breast cancer research nurse. So talk about being diagnosed. You've seen cancer, but then diagnosed with lung cancer.
So for me, I am in a unique situation. As Chris said, I'm a breast oncology research nurse, and I am usually on the other side of the table. I am the person that when patients decide to go on clinical trials, I navigate their clinical trials. And of course, those patients are oncology patients. So for me, it was a complete shock to be diagnosed with lung cancer. I have an extensive family history of lung cancer, but, you know, my grandfather died of lung cancer. And I always thought, you know, I was a young girl. He died in 1984. And we knew that he was a smoker. So, of course, we thought, you know, grandfather died of lung cancer. It's because he was a smoker. No problem there. And later, after I was diagnosed with stage 4 lung cancer, I learned that his father died of lung cancer. I learned that my uncle, my mother's brother died of lung cancer. And after that, my grandfather's sisters. I mean, it was just a whole history of people that were diagnosed with lung cancer. And after my diagnosis, I had extensive genetic testing done, and it showed that I carried a germline mutation of EGFR. So therefore, you know, I didn't know that. It was a complete surprise. And yeah, I've been trying to still wrap my brain around the fact that I, you know, was diagnosed with stage 4 lung cancer.
Yeah. So, you know, Alicia, again, you're a breast cancer research nurse, and again, I'm bringing some of these things out in terms of just the difficulty that even if it's just lung cancer, just in general, not being Black, but just in general. I mean, you know, lung cancer, it's only been recent that people have actually thought about it, there being a hereditary component of it, right? So were you thinking at all? Was that on your mind at all?
Not at all. So actually, because my mother was, she died of breast cancer. So not only was I a research nurse, I was also in the high-risk clinic being followed by the high-risk docs there, the oncologists in the high-risk clinic. So they were kind of monitoring me for breast cancer, and I was getting routine mammograms even earlier than most. And then when I presented with, I had a chronic cough, very similar to some of the other people that spoke, those underlying symptoms, everyone kind of ignored it. And then, of course, I was being tested for allergies, and then it was GERD. And after a while, I used my influence as a nurse, and I was like, well, hey, I got these symptoms. Doctors were literally saying, oh, you got a new dog. It's your dog pulling, it's musculoskeletal. Because if you look at the risk factors, it just didn't line up with my age and my smoking history. I'm a non-smoker. No one thought, oh, let's go from back pain to lung cancer. But it was that encouragement from my fellow peers, other physicians and nurses that encouraged me. They're like, that cough is just not right. So they constantly encouraged me to follow up with my primary care doctor. And I was reluctant, I'll be honest, because I did not want that copay. So I was like, I didn't meet my deductible. I never met my deductible. I didn't want to do that. And then eventually it would go away. The pain would be there. Then it'd go away. And then I'll say, oh, it's nothing. And then weeks would pass. But then after a while, the pain got so bad and severe that I ended up going in with the encouragement of my office mates. They're like, you need to get a CT scan and follow up on that, like your doctor said. And it turned out, I mean, they ended up doing a bronch and I came out of recovery and my husband was there and he was like, the doctor was really upset. She was tearful and they think you have cancer and they think it's breast cancer. So woe and behold, the path comes back and it tests positive for lung cancer. So the doctor that I asked to review my my scans beforehand, I selected her to be my oncologist and she's been taking care of me since that time. And that was in June of 2019. So when they told me that I had lung cancer, and then the thing that I think is really unique, and doctors don't do this, but they said after I had a PET scan, it showed that I had mets to my bones. And nobody could actually say, oh, you have metastatic stage 4 lung cancer. That never came out of anyone's mouth. It's just from my knowledge, I was like, that's stage 4. And that report belongs to me. I was in complete disbelief. I could not imagine in a million years that I would be on the other side of the table and someone would be telling me that I had cancer and it was metastatic and it was already advanced. And I could not even fathom the words I couldn't even process the entire thing. And I still have problems believing that that's me, but I guess by now I have to, kind of get over it. I'm being treated and, I have a huge support system and I like to be an advocate and help others in any way that I can. But when I talk to those patients now about their cancer journey, I actually see things through a different set of eyes. So it's been a journey for me.
Thank you, Alicia, for sharing. Again, all of you guys have these little different kind of perspectives that are that important. When we're doing this conversation, again, we could have survivors on, we could have caregivers, we could have primary care docs, but your connections where you have these layers are so important. So it challenges us, again, as we're looking at how do we help our community, how do we help the Black community, that we recognize the challenge of lung cancer is a challenge outside of the individual communities, but just thinking of lung cancer in general, based on your stories that really speak on how difficult it can be and how important your community is in challenging you to go and get checked and how important it is for a primary care doc to hear something and know something and get that. That a lot of things have to kind of work out together. And so we know that changes have happened. That because of research, that there's been amazing advancements in treatment. And that's why, you guys on the call have been doing well. But Amy, when did you find out that they were going to do biomarker testing, comprehensive biomarker testing? Because you told me earlier, before we got on this call, that you were out positive. Well, when did you get testing, and did you have any clue about it before the test?
Yeah, my journey was actually similar to Maisha's husband. When I was diagnosed, went to the local oncologist, his first reaction was, okay, I'm gonna figure out what kind of chemotherapy you're gonna do. That was the first treatment, I guess. And I just it didn't seem right to me, didn't seem to be the best thing for me. Not that I knew anything about the treatment or what options I had. But so my family, we started doing research, went to the internet and try to find research hospitals, research centers that treated cancer. And we found M. Anderson that is near here in Florida. I mean, near to Florida, but it's in Texas. And then we found out about Moffitt. So we elected Moffitt, made an appointment, and Aaron saw Dr. Janelle Gray, which is just amazing. She was the very first person that sat down with us and explained that we did actually have other options, that it wasn't, sort of the end of the line for me, that we could try different things. And she said that, we can do genetic testing. They did the biopsy first there. They hadn't done that at the hospital. So that's when I found out that I was ALK positive. And actually, it wasn't a very clear result. She told us it was very borderline. It seemed like it could be ALK positive, but maybe not. So she just went ahead and I guess took a leap of faith and decided that she was going to go with the ALK positive diagnosis, and that opened up a huge door for us because we were able to get targeted therapy, which moves us away from something that is more harmful in some cases, I guess not all cases, as such as chemotherapy. So I started taking Xalkori initially, and for the most part, I felt very well. I was able to function for 5 years on Xalkori until I started progressing. They found some brain lesions, and more recently, last year, I had to switch to another targeted therapy. Thank goodness, which, she was also able to point us out to the new drug. And that's where I am. But, and also what Maisha said, I mean, you needed somebody that is more human. She had family that had been sick, and she was able to identify with us. I'm sorry.
Oh, you're good. I mean, you wanted to share that because it's critical that we know that that's where the changes happen. The Xalkori that you said that you were on, that was approved 10 years ago, right? So if testing is not done, that is unacceptable right now. You have to know that there are options. It doesn't mean that everybody's going to be able. They're not all going to be ALK positive. Not going to be all EGFR positive. My wife was tested January 2011, and she was negative for that, right? Sydney, being as a doctor for you, did they test right away? And did you know that they needed to?
So this is one of the things that I think that needs more awareness of, because even though I'm a doctor, when I was going through my residency program, they didn't really talk about these biomarkers. So I didn't even know about it. And to be honest with you, with how fast they went through my testing, I mean, when I raised the alarm with the chest x-ray was like January 25th to the day I sat down in front of my oncologist and she told me I was stage 4, that was February 28th. Right? So it was literally a month. And to be honest, I may have had angels that were taking care of me because I didn't ask for it. I didn't know about it. And my first visit, she told me, first of all, I went there thinking I was stage 3 and that I needed to do chemo. And she said, no, you're unfortunately not stage 3, you're stage 4, but you are ALK positive. And then she explained what all of these different mutations were and what they meant. And me being ALK positive, what that meant for me. When I was diagnosed, crizotinib, Xalkori was still first line. And I was started on Xalkori. I think, funny enough, like probably 2-3 months later, they actually made alectinib first line. But the crizotinib for me has been working, so we'll stick with it. What's not broke, don't fix. But I think for me, I didn't know about it. I was lucky enough that it was done right away. So I was never told I needed to do chemotherapy. And I think for me, that was what was so important for the tangent of where I've gone, because to be able to be diagnosed with stage 4 lung cancer in internship and still be able to continue it and finish my residency on time was very important to me. My medical career, I've wanted it since I was 4, was very important to me. And I would not have been able to do that had I gone chemotherapy route. So I was very grateful for it. And that's one of the reasons I always tell even my new patients, ask if there are biomarkers. I don't care, what cancer it is. I tell them, ask for biomarkers, ask to see if you have some sort of biomarker. Because I think that it's very important, and just the quality of life difference is it's so important. I was on a call recently, and one of the oncologists was talking about biomarkers, and one of the things he said is, if someone is diagnosed with breast cancer and they do not do hormone testing, it is almost a crime. So why is the same not done for lung cancer?
And that's exactly what we have to fight for. And that's what you're saying, Sydney, is that's not a black or just a white thing. That's across the board that hasn't been accepted. Now, what we know is where people don't have an advocate, it will be enhanced because of that, but it has to get done.
And the thing about it is that I feel that it's really about re-educating, and it's not only about re-educating, patients to advocate for themselves. A lot of it has to do with awareness with the oncologists, the primary care doctors, the patients themselves. I mean, patients will come and, the first thing they ask is, so what about that immunotherapy thing? And they know that, of course, because they see the Keytruda ads on the TV. So at least they know to ask for that.
Yep.
But no one knows to really ask for biomarker testing because, of course, there's no awareness to it. And I think that is really what we need to fight for is, for everyone to become on board that this should be standard of care. You get a lung cancer diagnosis, biomarker testing.
There you go. There you go. Well, I know Mouraf is a stickler for time, so we only have about a minute or two left. So I'm going to give you guys to give a couple of words to people, and then I'm going to wrap it up because I want you. What would you want people to know, Noemi? What are those just real quick, based on your diagnosis? What would you have wanted to know before?
I would say that that it can happen to anyone. There's a misconception that you need to be a smoker in order to have lung cancer, and that's definitely not my case, and it's not the case of many people. I think that is important.
Thank you. Alicia, what would you tell? What would you tell folks?
Basically, I would tell them that just don't give up and don't ignore the signs that are out there. I think it's so easy, and I can say that I'm guilty of that too, is if you have symptoms and you present with something, keep looking for the answers, because there is probably something bigger out there. And I keep thinking to myself, had I done that a little better, maybe I could have caught my disease before it was as advanced as it is now. So just keep looking, keep asking the right questions, and keep inquiring.
Awesome. Matthew, what would you tell them?
I think we need to do better. Honestly, I think we all need to do better. Doctors, researchers, cancer specialists, community activists, we need to do better because we're missing this cancer in the early stages. And that's what drives me. That's why I like working with Mohaf, Maisha, yourself, and others. We need to do better to not miss these early subtle signals. But 100%, standard of care is standard of care. That's why it's called standard of care, and people should get it. Whether you're whoever you are, you should get standard of care, and that is not happening right now. That is not happening. If you're poor, if you're Black, you don't get standard of care as much as rich or white, and that's got to change. That's not acceptable.
It's got to be unacceptable. Sydney.
Yep.
What do you have? I know you already broke it down. Give me just a little something for them.
I think that one of the things that we need to stress to, especially the oncologists, is that I mean, as a doctor, I never want to give inferior care to my patients. I want to give them the best. I want to make sure that I'm giving them the best drugs possible. But giving a patient chemotherapy who can get targeted therapies is giving your patient inferior care. And if we hit that with them, I think that will then have people starting to do the biomarker testing. When you have only 30% of lung cancer patients actually getting biomarker testing, I think that is a crime. And I think that is what needs to change.
Absolutely. That's so much why this is Project Radical. We're talking about a radical mindset, a radical shift, but it's not anything crazy. What we're talking about is getting in alignment with the things that we know. Mohaf, can you give them some words here before I put a little kind of dot on the I? Mohaf, why is it Project Radical, right? All of these things speak to exactly why it's Project Radical.
It is radical because, again, as Matthew said, those standards of care are not given for everybody, and this is wrong. This ought to be to stop. This is radical because as people who have access and resources, or get lucky, or advocate for themselves, are surviving and staying and benefiting from advances in sciences, other people are not, and this needs to stop. And we're doing it radically by bringing people who have this story, who are doing this work, people who are living these experiences. I have stage 4 lung cancer, and among us also are people who took care of their loved ones who we lost to cancer. And we need our voices to be heard. I do live with survivor's guilt that I come closer to my 5th year and others are not. And this is not right. And we want everybody to have their chance to live and to take advantage of the science that's coming. That science, that healthcare needs to be for everybody. And today it's not, and that ought to stop. And this is our message.
Awesome. Mohaf, thank you for your leadership. Thank you for seeing this as you and bringing the group together in terms of Project Radical. Thank you, Noemi, for sharing and being so honest about your journey. Thank you, Alicia, for giving us that good, real stuff in Sydney. Sydney, yes. Thank you, Matthew, my man, right? And then Maisha, we're kindreds. So thank you. Appreciate you guys for being willing to share. And I think as we talk about this again, the bigger issue is that lung cancer is difficult. It's a difficult disease to be able to diagnose. We need to acknowledge that, own that. But it's even more difficult if we don't acknowledge that anyone can get it. If we don't acknowledge that healthcare at times is not welcoming. So we need to make sure that we build stronger relationships with it. And then it can be even harder when you do walk in and the standard of care is just not offered and that you have to fight for that. And so Project Radical really is that. it's a challenge to all of us to say, will we live with a sense of urgency? As Sydney said, do the people matter? If it's not okay, if the standard of care is there, it has to be done. And so we need to make sure that happens with a sense of urgency, as if it was our wife, our husband, our kids, our mom, our dad. Will we fight to change these things with that type of sense of urgency? There are things that we need to work on. That's what research is for. But there are things that are clearly already victories. And we need to make sure as many people that can benefit from them are a part of it. Thank you guys for joining in. I know we ran over a little bit, but we needed to so that we could set this thing up for these amazing conversations that are going to continue. We have some great experts. Murafa's done a great job of bringing people together. And we are bringing up issues that really help set the stage in terms of what needs to be done. But the reality is, if we want it to change, we won't have to go fight and go get it. But we're not just randomly fighting. We're fighting for people because they matter.